Yesterday, March 6, we had a 35.9% positivity rate with some 723 Jamaicans testing positive for the coronavirus. Let that sink in. Let it sink in that that positivity rate means that our hospitals are going to come under pressure, significant pressure. Let it sink in that our public health workers, our nurses, our doctors are going to find it very difficult to cope with those who come in and need medical care. Let it sink in that it means longer waits. It means persons having to suffer for longer periods before they can get a bed. And generally speaking, a health system that is going to experience significant stress and fatigue. Ladies and gentlemen, Jamaicans, the truth is we're not trying hard enough. I accept that the government has a responsibility. But let us be clear, a lot of the spread that is taking place in this country is because too many of us are ignoring the need for personal responsibilities. I just drove through Halfway Tree, and for every one person I saw in the center, only 10% were wearing their mask. That's 1 in 10. That's not good enough. It must sink into all of us that the government alone, the public health system alone, our nurses and our doctors alone, the cabinet of Jamaica alone cannot address this virus and its spread and the consequences that it will have on our people. It must sink in that 723 persons in one day, and more importantly, over 3 out of every 10 persons tested are positive, means that corona is right across the length of our population. It must sink in that if you continue to have the parties, the drink-ups, if you continue to ignore the protocols around gatherings, and you congregate and you don't wear the mask, then the chances of your getting the coronavirus are real, and the probability is increasing. And when you get to the hospital, the chances of your getting a bed is going to become less and less. Jamaicans, people will die. It's as simple as that. I am sorry if some persons are offended by this straight and plain talk, but I believe that it is very important that all of us appreciate and understand the consequences of our action. This is not an attempt to rid government of its responsibilities, contrary to what some may say or some may think. The truth is, we do not have enough policemen or soldiers to police every shop in Jamaica, to police every beach in Jamaica, to look over every single individual in this country. And it is downright unfair for persons to blame our public health officials, our public health team, our doctors and our nurses when they cannot get through at the hospital because they are there because they went to the party that they should not have gone to, or to the beach or the funeral that they shouldn't have congregated at, and have picked up the virus, and then they expect the government or the public health system to solve the problem. And if we don't do it, we get cussed. So yes, I am saying 723, March 6, a 35.9% positivity rate. I really hope that will sink in. And it will sink in our consciousness to help us to understand the importance of personal responsibilities. You know, in many countries throughout the world, there is total lockdown when you have spread of this kind. This country, this government took the decision that people have to work. They have to go about their business. It is possible without spreading the virus if they obey the protocols. I say to you, too many of us are not. So 723 is a defining moment for us. And yes, I'm saying, let it sink in. And hopefully, in sinking in, many of us will understand why it is that we need to do better. We will continue to do what we must. as a public health system, as a government. We will work hard to provide the beds, to ensure that the doctors are alert, to ensure that you get triaged or looked after when you turn up. But the reality is there's so much and no more of us. There's so many beds and no more beyond a certain point. And truthfully, it doesn't have to be this way. We don't have to have the overcrowding if we respect the protocols and take personal responsibility. I really hope for all of us, better days ahead. I believe there will be better days ahead. The vaccines are expected to arrive tomorrow and others to come later on. We will now embark on one of the most significant logistics exercises that this country has seen. But it is important that we recognize that until then, we must observe the protocols. We must continue to wear the mask, continue to physical distance, continue to sanitize. Otherwise, we will see worse days ahead, not better days. Let us do the right thing.